Okay. Uh, First and foremost, I'd like to give thanks to everyone who's watching this video for taking the time. These are very serious times that we're in. I just wanted to take a minute to touch on some very important points, particularly as it relates to the coronavirus COVID-19 pandemic. Over the last few weeks, we've been trying to identify as responsibly as we can all of the pertinent information that will help to empower our people. So the idea here is very simple. They say that information is power, so therefore we would hopefully like to responsibly inform you, so that, or inform those who are willing to listen, so that they may then empower themselves. As it pertains to the virus, a virus itself is actually a microorganism that has RNA and DNA, just like a human being, that actually lives and exists off of another host. It actually takes the host over. Okay? This is what a virus actually is. And I thought I should touch on that because there are a lot of terms that are being given and a lot of information, and in many instances we may not really understand everything that's being said, so therefore we can't use the information to then use it to our benefit. Okay? Now, at this particular time, unfortunately, after more than 400 years in the United States of America, black people have, as I've stated in previous videos, we have received unequal and uneven and in many instances unfair treatment when we've gone before various institutions, whether the institution was political, judicial, health, economic, social, you name it. So likewise, with this particular pandemic, what's going to happen as our experience rather with the health institution, we have not unfortunately received the same care that other groups have received. Now this is a very important point for us to consider, because at this particular time that all of the businesses are shut down and so forth, I think that many people may have the thought in their mind that they can just sit this out, that they can quarantine themselves and they can hide and they'll be okay from the virus. Nothing could be further from the truth. In fact, what's going to happen is this, and I'm saying it now, today, because you will see this happen weeks from now, is that once the curve is broken and businesses start to open up and we go back to quote-unquote normal life, what's going to happen is after that time, there's going to be a tremendous upsurge and uptick and an explosion in terms of the virus in lower income, usually black, brown, or Hispanic areas. Why is that going to happen? Because traditionally, those are lower income areas, so they tend not to receive the same service that those more exclusive demographics receive. This is what's going to happen. So, my point is this. Since we are in a position where we cannot readily rely upon the institutions to give us the protection and the care that we need. This is not optional. This is something that we need. People are dying from the virus. Okay? Since we're not in a position to expect that we will receive that care and that protection, then we have a responsibility to seek out that protection and that care for ourselves. The first rule of nature is, was, and forever shall be. The first rule of nature is self-preservation. If you corner a kitten in a corner, he's gonna fight for his life. That's a kitten, but you got a life and death battle on your hands at that point. So we're bringing the information now to help our communities to be able to empower themselves and protect themselves in regard to this virus. This is exactly what we're doing. In fact, I need to let everyone know, and you need to pass this word along, that I have the critical point that all of us should consider is, what can we do to enhance, increase, and improve our immune system? This is the key to the virus, because as I said before, the virus is not going away. When the curve breaks and businesses go back to normal, the virus is going to be here for eternity. The HIV virus is still on the planet. The Ebola virus is still on the planet. The influenza virus, the common cold, is still on the planet from when it started. So for anyone who thinks that they can hide from the virus, that's not the case. Rather, the question should be, what can I do to empower my system so that if and when I do come in contact with it, I can have a positive or successful outcome. And that's what I can now say as a result of recent conversations that I've had with an African herbalist, and I've also made contact with an organic agricultural organization in Africa, where we'll be able to get all of the necessary herbal remedies. I've already placed the first order. It's going to be shipped this week. So more information and how you can get these things will be forthcoming. You can inbox me. You can also go to the on Facebook, the Good Life organization, and you can leave a message there. We'll have people who will check that as well. But the point that I'm making is this, is that as promised, I said that we will be bringing forth more recommendations of what we can do to protect and to sustain ourselves in regard to this virus. And your brother didn't let you down. And I'm very relieved to say that even some of the information that I didn't know where I would be able to get it, I've made the type of contact and connections with those people who had information that I knew I needed and didn't even know where to go to find. So we're in power. So I think I want to close with that. There will be more information about how you can order the products, and I mean, we've got fascinating things that will help to, as our motto with the Good Life organization says, help you to live better, help you to live better, stronger, longer. And in closing, I just want to say this, that the grass is always greener where you water it. Be good to yourselves and be good to each other. That's it.